It is truly exciting to be here today as we prepare to open this state-of-the-art healthcare center. Much hard work has gone into getting us to this point, which has been driven by a vision of quality care for our residents, for today and for the future. We give many thanks to all who've been a part of bringing us to this point. Welcome.
It really is hard to believe that 2 decades have passed since the Pathways grand opening back in 1998. Now, we wanted our new building to have several important features. So after we took all those pictures and made all those visits, well, what did we come up with? And I want to read these because I think they're very important. And the next time you're in Pathways, visiting someone or walking through the floors, maybe you'll take note of some of these things that you might otherwise not. We wanted an attractive main entrance and lobby, which we've just renovated. We wanted what we call a divided double room design, resident room design for maximum privacy and space. Windows were very important. We wanted windows for each of the 126 rooms and most of the common areas, because natural light is extremely important. It's important to good health, physical and mental health, more importantly. And we wanted warm, spa-like shower rooms. We wanted 3 neighborhoods with a central nurses station that has a private work area in the back, because we wanted to emphasize with the neighborhoods a family atmosphere. We wanted living rooms in each neighborhood, a large lounge, and a private, quiet room on each floor for families to gather at certain times. Now, the large lounges feature aquariums, and they overlook the central garden, which, by the way, is dedicated to Ron Dyson. And it also overlooks our koi pond with floor-to-ceiling windows. We have dining rooms on each floor with abundant natural light again, and the residents, importantly, order off menus. They have a choice. Restaurant style as opposed to trays. We wanted a large ground floor multi-purpose room for meetings, activities, and other events and celebrations. We wanted a large therapy and rehab area that actually has an apartment for occupational therapy training and testing, which I thought would be a good feature. We have a secure private garden for residents and their friends and families. In fact, you're going to be going there a little later on for some light refreshments. And finally, we wanted easy access, as easy as possible, to all the PPH buildings by way of a connection to the Midway building on each floor. Now, Pathways was in 1998 and still is a unique and beautiful skilled nursing and rehabilitation center. But it is the people, the residents, their families, our volunteers, our friends, our board members, our leadership team, department directors, and the people who are really there every minute of every day, the line staff, working with the residents, making their quality of life as good as it can possibly be. That is what has made it such a unique and special place. What I think is the premier senior living community skilled nursing facility in the Delaware Valley. So, what do we do in Pathways? Short-term rehabilitation following hospitalizations, management of chronic illness, end-of-life care, and finally, the ever-growing area of memory support.
I'm honored to be here today to say hello to the residents here, folks who come here for service, the staff. They're very, very, very welcoming, and I want to say thank you, staff of this facility. I worked at the Philadelphia Urban Coalition with Charlie Bowser back in the early 70s, and we took on the issue of services for the elderly. For me to begin to understand as we age, what kind of services and how will we live in our home or how we live in a facility, and what kind of facilities there are for families, and the quality of life in the nursing homes that existed. So we had public hearings in City Council to discuss what was the state's responsibility to providing quality care for our seniors. So there are people and will be people who will have supportive service, but there will be thousands of families who don't have the supportive services. So I'm proud to be here to say congratulations to the Protestant Home.
What a tremendous honor to be here together celebrating 2 decades of Pathways, a place so many residents not only call home, but also where they can receive a full spectrum of life-enriching medical services and programs. Dedicated staff here provide award-winning skilled nursing, short-term rehab, and a full scope of therapies including recreational therapy, physical therapy, occupational, and speech therapies. We also have a new full service of in-house pharmacy for ease of access, affordability, and convenience for residents and staff. And a beautiful and spacious new lobby where families and friends can gather and spend quality time together. We could not be prouder of our incredible staff who provide the highest quality, compassionate care and have helped Pathways earn a place for 6 years on U.S. News and World Report's list of best nursing homes in the nation, as well as consistently receiving the prestigious 5-star rating from CMS. Since 1998, PPH has cared for nearly 4,000 skilled nursing residents and provided nearly 1 million days of care to skilled nursing and rehab residents and community members combined.
So on behalf of my family, we would like to give a special thanks to our fabulous Pathways staff for the care given to my grandmother and the support to us as we went through this transition as a family. And when you look around at this gathering now, every resident, every staff member, whether you're a nurse or you work in housekeeping, every board member and every visitor that comes here, and giving a special nod to those who have gone before us, played and plays a role in our success, and you have my thanks. We enter here as strangers and we leave here as family.
1998 to 2018. What is most important in these dates are not the numbers, but the dash in between those numbers. The dash represents all that has happened since that day in October of '98, when the board of directors and the administration took a brave chance and opened this building we now know as Pathways. So in closing, I'd like to leave you with a few words that exemplify the staff of PPH, and they are: love what you do and love where you do it. And I can safely say this is what our staff here at PPH is all about.